Hi everybody, so today is Q&A Friday. So I've gotten a few questions, very good questions, so I'll just get started. First one comes from Elisa Lyons. I'm having issues with swelling. My eyes, eyelids behind my ears, and my stomach swells. I can't find any link with food, hormones, or medication. My stomach swells to the point that I look pregnant, and my BMI is normally low. However, when I swell, it jumps well over 30. So BMI is what we use to measure your obesity. So if it scales up, then we kind of categorically place our patients in or scale them in their risk for obesity and such. So that's what BMI is. And my eyes literally feel like they are growing in the socket. It's accompanied with blurry vision, sensitivity to light, and a migraine that is all over my head. My doctors dismiss it and can't seem to find the cause, but it's extremely painful. Two things come to mind. I think you might have some type of a kidney involvement, because when you do have kidney involvement, your eyes will swell like crazy and you will blow up. But something tells me that it's a little bit more than that because of the abdominal swelling. So I've had a few patients in the past where they've kind of went to Mayo Clinic for a full workup. And I remember this one particular patient was just like you, where she totally exemplified that like pregnant-like appearance, and she couldn't get her pain under control. And she had all those issues. So here's what I come back to saying all the time, and I know it's kind of getting old, but it's going to be the common thread to everything that I say. The fact that you have migraines and that you're able to be swollen enough to where your weight goes up tells me that at the cellular level, when it's not able to detoxify, kind of get an exchange for food as fuel into our cells so that we generate enough energy to move and think and all those things. But if there is a toxic overload and things get sort of stuck, that's when we start to have not only the inflammation that's systemic, but also our cells start to swell up. And your kidneys and liver are not able to detoxify things. So I have a saying, you are what you eat, yes, but you are what you eat and what your body uses. And you also are what you can poop or pee out. So if you have a lot of toxic overload, it's a classic presentation of how this would present. Love to help you. We've got a great detoxification protocol that I help you to not only get all the toxins out through your poop and pee, but also it really nourishes your cells in a manner so your cellular level or cellular health is restored. So you really want to look at this from a whole standpoint, because it is disrupting all your organs, obviously. And this type of interstitial filling where you kind of retain all this fluid inside your cells and in your lymphatic system, that's really a cause for concern. So immediately I would see if you can talk to your rheumatologist to see if you can get a kidney checkup. It's an easy like a urine testing that they do to make sure that the protein levels aren't out of whack, because that can cause a lot of what you're saying. But I think more than that, because of the migraine issue and then the swelling of the tummy, that indicates a lot of the other issues as well. Again, you guys, lupus can be so dangerous, and it can really ultimately, with a snap of a finger, get so bad that your body starts to shut down. So you want to limit that, or you want to prevent that by doing your part. So please get that checked out. And if you want some help from me, would love to help you. So just go ahead and leave a comment, or I hope that that was enough. So I'm going to move on to the next question. If you have any other issues or questions regarding this question that you asked me, then you can go ahead and feel free to ask that in the feed. Second question comes from Cynthia Hildreth, and she asks, do vertigo has anything to do with lupus or fibro? Well, both of them involve the central nervous system. So it's an energetic energetic dysfunction, right? So when we talk about energy, it always comes back to the cellular matrix. Within the cell is what's called mitochondria. And that's the cellular powerhouse where we're able to exchange biochemically all the things that comes into our body in such a way to process that information and have a DNA exchange of sorts. And your body is capable of then utilizing the food as fuel, breaking it down into its respective biochemical substrates to make sure you get the energy inside, and then we then produce what's called currency for our body, which is adenotriphosphate, which our body then uses for energy, both for our skeletal muscle so that we have that energy to kind of boost through and move, as well as for our central nervous system. What most people don't realize is that our central nervous system utilizes a lot of the energy to think, and any thoughtful processes takes a lot of energy. Our brain requires a lot of energy. And so of all the organs in our body, our brain and our skeletal muscle takes a lot of that energy. And so if that's insufficient, you will see manifestations as a secondary effect, having vertigos and such. Now, conventional treatments are a little bit different, and the way they go about it is give you a pill to kind of, prevent that vertigo from setting in, because vertigo is a very weird kind of a dizzy spell that you get from positional movements. And so there's different categories of vertigo as well. It can be a positional vertigo, in which case where it's like when you, let's say, go from lying down to coming up, and then your body sort of has to calibrate, or your brain has to calibrate to get its focus back, and it can cause blurry vision as well. Or some people get so nauseous, it's like getting on a roller coaster ride, that kind of a sensation. Those are all abnormal, you guys, but it's a secondary effect. So there's a direct cause and effect, but this is sort of a indirect effect of lupus, if you will, right? So nothing makes black and white sense. I wish it did, but unfortunately what we live with, the lupus, is not so black and white. So I hope that kind of gave you some insight to the vertigo as it relates to lupus and fibro. Another question by Angela Castrovinci. I was diagnosed today with systemic lupus. Is that any different than normal lupus? Is there anything that helps with energy? So she asks again, a lot of the fibromyalgic patients, a lot of the lupus patients, or even MS for that matter, any autoimmune conditions that you have, we have a tendency to be very fatigued. And again, we have to look at the engine, right? The cellular level, as I mentioned, the powerhouse in our cells, which is the mitochondria, and that's where all our energy is produced. We're dysfunctional. We're not able to get whatever needs to happen to produce that elemental energy as currency that our body can then use as to move in the skeletal muscle. Our organs need ATP, the energy that it needs to do what it does. And then most importantly, we need our brain. So that's the energetic component. And yes, there's absolutely so many things that you can do. But before that, sort of differentiating between what's normal lupus as opposed to the systemic lupus, I will send you a link that I talk about in my blog, differentiating different types of lupuses. And so without going into this, I think we did a Q&A about the different types of lupus last week. So I will make sure that we include the link to that Q&A for your benefit so you get clear. But coming back to this energy issue, all we're trying to do, everything at the end of the day, when I guide you through the elimination diet, That's under files. If you want to take a look at what that entails, under files, you should see a file that I uploaded way back when I first started this group. There's a lot of resources, but one of which is elimination diet, where you start to eliminate. There's different degrees of elimination diets, but I give you the comprehensive form. The idea is to make sure, you know, we have a lot of junk within our body. It's sort of like if you can think about your house, you've got a lot of dust particles. Right now, I'm getting my house renovated, and through the demolition process, there's a lot of dust stuck in the vents as well as in my house. And so everything sort of settles. And so before I can start to decorate and have a functioning house again, what do I have to do? I have to clean everything out, get rid of all the junk. And then only then can I have clarity enough to know exactly where things go. And then I place things in a manner where everything's going to be optimally functional, right? Our body's the same way. A lot of the times, what came first? With lupus patients, I believe the toxic overexposure, it might have been the medication, it might have been the stressful lifestyle, it may have been anything. But something triggered our body to go dysfunctional enough, long enough to where our body started to accumulate enough antibodies to start attacking ourselves. And so that's the whole systemic lupus. And that really is the most common form of lupus. But the energy depletion that as a consequence to having lupus is the biggest factor, because that's why we can't supply our brain with enough energy. And when our brain doesn't have enough energy and oxygen going there because of the toxic overload, what happens? Many of you complain about inability to think, inability to remember, be sharp on your feet, and so forth. And so that's something you can reverse, you guys, through infusing yourselves with the bioavailable nutrients. And I don't apologize for the products that I supply or promote, because it's changed my life, and I see this changing every day with my patients. So I do have that alkaline detox complete protocol available for you. I'm also going to insert a link in this post feed, because I believe in it so much, because it can transform your life. It can change the way you look at food and how you take in the food and so forth. And that's how you can enhance your energetic process, by healing your cells at the cellular level, by supplying your cells enough energy so it can do its thing, by providing currency. We need money to live, right? It's the same way for our cells. If it's not able to produce the cellular currency for exchange for energy, well, you're just going to sit there and be fatigued and take more meds, but that's really not the long-term solution, is sort of the moral of the story here. So I hope that that's clear. And if you have any questions, if you wanted to work and check that program out, please do write a comment in this feed so I can help you. Another question comes from the YouTube channel. I have a lot of followers now. I'm getting a lot more. And this one comes from, I don't know her name or his name, but it's I Am Love Unity. She asks, "Hi, Dr. Connie. I want to know, can you please tell me more about esophageal spasms and raw, swollen, and painful esophagus?" Esophagus is our throat, basically inside, right? So because lupus involves multi-systems, especially the GI, it's considered part of our GI tract, right? Gastrointestinal tract. And so what I see a lot is that a lot of patients get gastric or GERD, gastroesophageal reflux disease, where, patients will be prescribed some antacids to take. But really, we're finding that lupus patients and autoimmune patients have a lack of hydrochloric acid, not an excess. But also, too, it's counterintuitive to think that you might have a food sensitivity, but really you might have an underlying hyperfood sensitivity that causes that itchiness and throaty kind of a feel. And then it becomes to be inflamed so much so that it becomes hard to swallow. And it's a very, very serious problem. I've treated many patients here, and we had to go through years of trying to get to the bottom of it. And so what I do in my clinic diagnostic is that you have to get a comprehensive stool test is the new gold standard to try to see if you have a H. pylori infection, because that can have a play. Second thing that I would do is make sure you get enough vitamin D, zinc, as well as magnesium in your diet, as well as I would do a simple SIBO, which is a small intestinal bowel overgrowth, where you have too much of a bad bacteria that's being fermenting down there in the small intestine where it's not supposed to be, producing a lot of the gases from it, and then causing sort of a backup in that. So that can be a part of it. So you can do a small breath test to indicate if you do have SIBO or not, because we're able to measure that gas that you're through your breath. And that would be something. As well as in this case, I would do a very comprehensive food sensitivity IgG and IgE testing to make sure we rule out those things, which helps us to kind of eliminate those things. And I know many of you guys are strapped for finances. So the easiest thing to do without doing anything, gold standard, both diagnostic as well as treatment intervention, is that elimination diet. It's a file I uploaded at the onset of creating this group. So there's really, no excuse if you really wanted to get to the bottom of this to try that elimination diet. And it's typical if you do indeed have some food sensitivity, if you feel itchiness in the throat for a while after you consume certain type of food, that would be a good indicator that you might have the beginning stages of it that ultimately can lead to this. So it's an irritating issue, but I hope you can work through it. It's one that it can take a while for you to work through, but it's certainly possible. Key thing, the underlying theme to all this is we want to be nourished, only eat the foods that's nutrient dense, but because we have a gut permeability issue, we want to sort of supplement with the proper supplements that sort of help us to heal our gut lining. We've got perfect supplements for you, totally focused for our lupus people, and it's on my website, Lupus Pharmacy with an F. We'll also provide a link there on our post. So I hope you start to utilize some of these things outside of the whole business model. Like, this is really intended so that you start to kind of connect the dots and use what I give you, so that in 2018, let's have some lofty goals to say, we're going to reverse lupus. And these are the things that you need to do, because if you don't take action towards those goals, we're going to be having the same conversation a year from now. And that's not the way I've lived my life. And that's not the way I choose to live my life. Like, next year, if I sit in front of the camera here, there should be a lot of goals that I've written down for the year for myself that needs to happen. And I feel if I didn't do that, I would probably be sitting at home, just debilitated, and just feeling sorry for myself and getting on all these medications and just taking a passive role in my life. And your choice to take a different trajectory, all I want to do is empower you. For those of you who want to be empowered. No judgment against whoever else that don't want to do that. But so please don't misconstrue what I say. But I hope all these questions helps you so that you can really ultimately at the end of the day take action. Okay? So please, Chris is one of the admins is going to tag another post, or what is that term? Repost? Pin the post up at the top in our group so that you can kind of accumulate more questions that you want answered. And this is something that I do. So please take advantage of it and ask away. Thanks so much for joining me. I'll see you next week.